Hello, my name is Dr. Teresa Corbett and I'm a senior lecturer here at Solent University. Today I'm going to be talking about how health psychologists have been working to promote effective health communication during the COVID pandemic. So what is health psychology? Health psychology is the study of psychology and health to promote general well-being and to understand physical illness. Health psychologists draw on theories and behavioural science approaches to change behaviour and to optimise well-being. They help people to deal with psychological and emotional aspects of health and illness, and they work to promote healthier lifestyles and try to find ways to encourage people to improve their health. And some health psychologists also work to improve the healthcare system. So as a specific example of the work that health psychologists do, today I'm going to talk about how they've drawn on theories and behavioural science approaches to create health messages that are engaging, motivating and effective. And this was particularly important during the pandemic when health psychologists worked with policymakers and communicators to advise the government on how to create effective messages to minimise the spread of the virus. So some key factors in effective messaging is that the messages must be accurate and clear. They have to be consistent so that they're saying the same thing every time we see the message. They should be easily understood, so they need to have plain language and ideally should be quite brief. If there's any diagrams in the messages, they should be clear and the source should be credible. So if it's a message from the government or the NHS, it works to have the logo so that it's more believable and people know that they can trust the source. The messages should also be empowering and emphasise social responsibility and norms. And a key factor in any messages that aim to promote behaviour change is that they focus on key behaviours and tell us what can we do to minimise the spread of the virus, for example, in this case. So if we look at some examples of campaigns that were used during the pandemic, I'm going to just critique them with these key ideas in mind. So the first one is this message from the government that has the stay alert, control the virus and save lives. First of all, it comes from a credible source. We can see the government logo and the NHS logo on the message, so it ticks that box. It's also motivating because it encourages us to save lives. But some aspects of this advertisement are less clear. It's not really clear what alert means, so how do you stay alert, what are we staying alert for, and how exactly do we control the virus? It's not a very direct behaviour that we can do, and it's not clear to us what needs to be done. So that isn't a good aspect of this message. It also uses the colour green, which tends to be associated with safety, and in this case we're trying to give a warning, so it might not be the most appropriate use of colour in this example. And that leads to it being slightly confusing. So this advertisement was changed slightly in the next iteration, where it became stay at home, protect the NHS and save lives. So again, stay at home is a clear instruction, it's a behaviour that we can do and that it's very clear to us what the message is. And it links to the statement that follows. We stay at home to protect the NHS and in turn that saves lives. So there's a direct thread going through the message, which is consistent, and again, it's that clarity that we're looking for. And also the colour change in this one, red indicates danger, it heightens our awareness, it helps us to look at the message and pay attention to it. However, in this message, there doesn't seem to be any logo, so we don't have that indication of the source of the message. So this message would have been improved by including something like the government logo or the NHS logo. This was a message that was released by the government around the summer in the first stages of the pandemic, and people at this stage were able to go on staycations. And part of the question here was, how do we communicate how to do that safely? So this message asks if you're going on staycation and tells you to plan ahead. It tells you to have a plan in case you get coronavirus while you're away. So it does have the NHS test and trace logo, so it's from a credible source. But a lot of this message, again, lacks that clarity that we'd be looking for in a message. Staycation, for example, means different things to different people. It might mean staying at home and taking time off work while staying at your house, or it might mean going on holidays within the UK. So there's different amounts of movement in either of those aspects, and this can be confusing for people. It tells us to plan ahead, but it doesn't explain for what or how we can plan ahead. So there isn't clear behaviours. And when we're told to have a plan in case you get coronavirus, well, it isn't clear why we would be travelling if we have any concerns about getting coronavirus. And at the time, the guidance was actually not to travel if you had any symptoms. So you shouldn't have been travelling and you shouldn't have been going away if you thought you might be at risk of getting coronavirus. And also that message there, feeling unwell, it's quite vague. It doesn't say if it's COVID specific, so is it just if you're feeling unwell in general? And again, if you were feeling unwell, you shouldn't have been leaving your home at that stage either. So this message was quite unclear and a little bit inconsistent in the messaging. Finally, this advertisement was released to encourage people to wear face coverings. Again, the idea here was that you wear face coverings to protect others. Again, it has the credible source, so it has the logos at the top of the message. It encourages social responsibility. There are very clear behaviours here that we're being told to do, to wear face coverings, and it promotes motivation to protect others. The behaviour is clear from the picture, and also this picture kind of serves a double function because it also depicts people social distancing. Even though that's not the message that's being promoted in the text, that kind of secondary aim of the illustration is clear for people to see as well. So this is quite an effective message and clear and direct and very focused on a specific behaviour. So health psychologists adopt an approach to behavioural science that enables us to optimise and improve existing public health messages, and this also helps us to guide kind of longer term strategies in public health messaging. Thank you very much for listening.